welcome to the Montana Hubcast. I'm Drew Ellis, and this is my co-host, Matt Blake. Say hi, Matt.
Thanks, Drew. This podcast is brought to you by Montana Hub, which is the app for the Missouri patients community. A cannabis conduit of knowledge, information, and hashtag cannabis sensibility for cannabis patients, community, and Missouri industry. It's all the businesses participating in Missouri medicinal cannabis in one place, in an app, on your phone, in your pocket. Montana Hub, where you'll find links to all the future Montana Hubcasts, including this one. Download for iPhone and Android at the app and Google Play stores. Just search Montana Hub. Back to you, Drew.
Wow, Matt, thank you. Thank you for that. And now, it's my great pleasure to introduce our guest, April Hatch, registered nurse with the Cannabis Care Team, which operates here in the great state of Missouri. So welcome, April.
Hey, everybody. Thanks for having me.
Thanks for being here.
Yeah.
So April, thank you so much for joining us today. We know that a lot of our listeners will be interested in what you're doing with the Cannabis Care Team. So before we get into that, why don't you tell us a little bit about your background and what got you into the cannabis industry and doing the cannabis consulting work that you're doing today?
Yeah, absolutely. So really, to talk about my background in cannabis, we have to go back to when I was an infant. I grew up in a cannabis-friendly home. There's pictures of me in front of cannabis plants when I'm like 2 and 3 years old. So I was exposed to the medical benefits of cannabis at an early age. Now, when I was in my 20s in nursing school, absolutely cannabis was not an option. I mean, I wasn't even allowed to speak about it. So really got away from it. But quickly, into my nursing career, I became very frustrated with just healthcare in general. I felt like patients were being written prescriptions to get sent out the door. There was very little education patients were receiving. It was, as we all know, this medication is going to help the side effects of this medication. I just didn't see a lot of people getting better. I just kept on seeing them getting sicker and sicker, and just really frustrated with that. So I've been lucky to find nursing positions where I can really focus on providing education and support for patients. So that's really what I've been doing over the last 10 years in public health nursing. It was about 5 years ago when my son suffered a traumatic brain injury, and he was seeing, several specialists. They were trying to prescribe all these medications he didn't want to take. Speech therapy, physical therapy. So we went through this for about 2 years before we started to talk about maybe cannabis as an option. The research started to come out that cannabis could be potentially neuroprotective and could really help someone who had suffered brain injury. So there was a lot of information to weed through. So really, honestly, it took me a couple years to get through everything to determine what was going to be the best cannabis for him, how to consume it. So that's really how I got into cannabis nursing, is, with my son. And then I just started talking to other people about it.
So April, kind of to dovetail into this next question, the Cannabis Care Team's motto is education before medication. So sounds like you did a little of self-education in regards to the brain injury your son suffered. So why don't you expand on that a little bit?
Yeah, absolutely. So as I said, as a nurse, I was not allowed to talk about cannabis. So it was really finding other medical professionals and nursing organizations that had that information, and really, I had to find the research myself and really dig through that to find, what was going to work best for him. It was really overwhelming, especially as a parent. You just never know. I had always heard about long-term consequences, and it was really concerning. So I know that currently patients feel the same feelings. They're overwhelmed. They're concerned about long-term consequences, side effects. And I think that education is important prior to starting. Cannabis really is a complicated plant. There's, the different cannabinoids, terpenes. There's, you're not only smoking it these days, there's so many different ways to consume it. Now we're looking at milligrams versus hits. So, I think for people to really get the most medical benefit from it, they really need some education before they get started. And so that's why we really focus on the education before medication, because it's important to have a good and safe first experience with it.
So April, we know you're an RN, and we know that you've got a lot of experience in your personal life and with your son with cannabis as medicine. Have you been through any, training specific to cannabis medicine? And give us some more of your educational background when it comes to cannabis.
Absolutely. So I've done everything that a nurse can do, basically. No, it really started with the American Cannabis Nurses Association. They do offer a really thorough course for nurses on cannabis as medicine. I've spent some time in Maine with Dr. Dustin Sulak. I mean, he's one of the best cannabis physicians in the world, and I really got to do some training with him and really got to spend some time with him seeing patients and how he does that. So I found that to be very beneficial. I'm currently enrolled in the first accredited program for medical professionals on cannabis medicine. So really anything I've been able to get my hands on, any certificate I can get, I want to do that. I think education for me is key so I can pass that on to patients. I'm a member of the Society of Cannabis Clinicians, a member of the ACNA, of course, and then several other organizations that offer education as well. So
that's awesome.
Yeah.
Fantastic. So just also really briefly, you are on the front line, so to speak. You're meeting patients on a daily basis, which a lot of these, dispensaries and grow houses aren't really doing as of yet. What's the feeling in the street about the perception of cannabis? Is there still a lot of reefer madness out there where people think this is something that's not really good for you, or is the perception really starting to change?
I think the perception has really started to change. A few years ago, I saw the most resistance among senior citizens, and now they all know somebody who has seen success with cannabis. I spoke with a patient today, actually, who's in his 70s. He's a farmer, and, he told me, he said, I would have never considered this before, but, my friends are, able to continue working their farms. They don't have the pain that they used to, and it's because of cannabis. So, it just takes one person to get them to change their mind and become open to it. So the perception is changing. Some patients still want to, maybe start with CBD before they try THC. Maybe they're a little hesitant to try the psychoactive cannabinoids. But, if you start at a low enough dose, there's really not a lot of psychoactive effects, and really there's just more medical benefits. So I think once people know that it's possible to heal without getting high, they're more open to it.
You touched on CBD. Why don't you expand a little bit about that? Aren't there like 6 or 7 different types of CBD, or the CBD families that you can talk about?
Yeah, so there are over 100 different cannabinoids that have been discovered. So THC is the one that we know the most about. It's been studied the longest. And then CBD, of course, has just gone crazy over the last couple years, because we have seen more research with CBD, because pharmaceutical companies are actually making CBD and using it for seizure disorders and pain disorders. So that's why we have all that research. And now they're starting to do research on CBG, which is really good for muscle spasms and helps people sleep. CBN really helps people sleep. And then, all of these cannabinoids have like antibacterial, antifungal, there's so many medical benefits that they all have. So I'm really hoping someday a patient will be able to have a product that's tailored for them and their condition. So the right amount of THC, CBD, CBG, and then all of them. So that's what I hope for in the future. But it is, we are in the very infancy of research on cannabinoids.
So April, tell us about how you work with patients, what they can expect from you, and just kind of run us through the process of how you work with a patient.
Yeah, absolutely. So that is definitely the biggest part of what we do is work with individual patients. So a patient either comes to us through the website, they make an appointment, or they reach out, through our Facebook page, or they call our 888 number. And the first call with the patient is always going to be a free 15-minute phone call. So, maybe a patient only has a few questions about their condition, or, maybe they just want to know where to go find a doctor to get them certified, or what cannabinoid works best for joint pain. So we always start with that. And then if patients find that they want to, speak for an hour or half hour, we will schedule that at that time. And then we're really going to look into the endocannabinoid system. And, we're going to look at other methods, besides consuming cannabis that will promote the health of their endocannabinoid system and therefore help relieve their symptoms. It's really helping the patients meet their goals and coming up with a treatment plan with them that will work for them. So that's typically, most patients will do the free 15-minute call and then the hour-long consultation. And then about half of those patients want to talk to me maybe every 2 weeks, maybe once a month. With so many people trying to get off prescription medications and, replace cannabis or replace prescriptions with cannabis, that can take, it's a process and you have to work with it, and they just like having that additional support. So
you see we hear the rumors about that, and just, the myth versus reality. How many people do you see trying to get themselves off of opioids?
Personally, I work with about 9 patients who are actively getting off opioids. And most of these patients have been on them for several years. So cannabis does work in a couple of different ways in doing that, and not only helps with the withdrawal symptoms, it also helps cannabis and opioids work together synergistically. So they're able to take a lower dose of the opioid. So it's been really effective. I've had patients after a week of consuming cannabis, tell me what a game changer it's been, how effective it is for them. So I think it, we have seen in the research in states that have had a legal medical program for a while now, we are seeing patients get off opioids.
That's fantastic.
Right.
Yeah, it is.
So marijuana's been around forever, April, but medical marijuana is new to the state of Missouri for sure. A lot of patients haven't had access before, and we'll be using a really high grade of medical cannabis, which can be pretty powerful. How do you boil it down to get the dosage for these for the individual patients?
Well, each individual patient is different. So I would want to, just encourage any patient who has questions or concerns about starting these, medical grade cannabis, to call me, to email me. I think that an individual approach is best for people. There's so many different delivery methods. There's so many different strains. They all kind of work differently for people. So I think having some, medical professional who you can talk to when you're getting started is key. And so many patients can't talk to their doctors, even if their doctors know the medical benefits of cannabis, for insurance or legal reasons, they're just not able to talk about it. So call me if you have questions about getting started. But I think another takeaway, honestly, for most patients is to start low and go slow. And the example I will use is, in most dispensaries, when you look at the different edible products, you'll find that they're typically in 10 milligram doses. Well, we have seen as low as 2.5 to 5 milligrams be effective for people with pain, anxiety, insomnia, and so many other conditions. So you don't have to start at that 10 milligram dose. You can start much lower than that. So start low and go slow.
And hopefully the feds, as I like to refer to them all as the feds, will legalize, follow the will of the people, legalize it, and let the scientists study it. Fund the research.
Yeah.
Canada's doing it. Israel's doing it. The plant has so much to offer, and we just don't even know how much good it can do for society yet because of federal prohibition. It's crazy.
Yeah.
That's a whole podcast. So
we're getting most of our research from pharmaceutical companies who are trying to make products themselves. And, these pharmaceutical companies are selling like the CBD product I mentioned for $31,000 a year to kids who have seizure disorders. And you think about, a kid could potentially get those benefits and more if they're consuming whole plant medicine from the CBD that we have available already. So yeah, once I think the feds make some changes, we may see patients have more access, to their physicians. Physicians being able to talk about it, is huge. These patients really don't want to do anything that their doctors don't want them to do. So, if insurance could pay for it, again, it can be quite expensive, especially if, say someone is taking a really high dose if they're wanting to treat cancer or something like that. So, yeah, we definitely need to make some changes.
That's great. At least in Missouri, we have the Constitution now that allows us to even grow our own cannabis. So if someone had the wherewithal to get some high CBD strains and just grew their own plants, they could put it in a blender and have it with a smoothie every day. And we can do that in Missouri.
Yes, we can. Love that. That's very big for patients. I think it gives them more control to ensure they have access to high quality medicine.
What percentage of your patients that you service are growing their own cannabis? Is that something that can be discussed?
Yeah. I'm going to have to say it's probably at this point like 10 or 15%.
Right.
Most of my patients are honestly, I'm a registered nurse in 33 states. So most of my patients are out of state. Missouri, patients are still waiting for the dispensaries to open. Yeah, most of my patients are new to this. They don't know what strain's going to work for them. They don't know if it's going to work for them, and they're not ready to make that financial investment into a bunch of equipment or the time and commitment into a strain that they may not like at all. So the patients who I talk to in other states do have access to dispensaries, and that's where they get most of their medicine.
I think I'm going to call you, April.
Okay.
Drew is a patient.
I'm still
888-810-WELL.
Yeah, I'm a patient, but I'm still experimenting with strains and
yeah.
So yeah, everybody could use some advice on it because it's a brand new thing.
Hey, yeah, no, I'm a patient, and it's still an experimentation for me too. So, I learn something new every day, and it, maybe tweaks my dosing a little bit, or, I want to add a little bit more CBG to my nighttime dose, or, yeah, it's a lot. And that's why I think it's so important that patients have someone to talk to about it, someone to help walk them through it.
What else do you recommend in terms of patients and patient care? It's brand new to everybody. Do people like keep notes? Do they keep record? How do you lead somebody through the process?
So I do recommend people keep a treatment journal, and I've actually been working really hard, and this is a prototype of a journal that I've created. So I'm sure we'll have a link to it on this podcast at some point. But so really with this journal, what patients are going to be able to do is they're going to be able to document the medication or the cannabis that they're taking. They're going to be able to document the symptoms they're having, the improvement of symptoms, the side effects, what doses work for them. And I think that that is the most effective way for patients to find what works for them. Because it does take some experimentation in the beginning. Some patients want to continue smoking it. Some patients don't want to smoke it. Some patients like smoking and edibles. And, it's an expense that a lot of patients are, maybe can't afford with, all of their other healthcare and medications and everything else. So it is definitely important to keep track so you know what's working. So this is a journal that we'll have available, and it also has some really good information on the different cannabinoids and what they do, the different terpenes and what they may be effective for. Start with education and then document it, your treatment.
All right. Well, that sounds great. Well, April, thank you so much for being on the MoCanna Hubcast today. Lots of great information, and I'm sure our listeners will be interested in speaking to you personally.
Yeah.
So thanks again for being on the show. Matt, thanks for co-hosting with me. And we'll see everybody again on the next MoCanna Hubcast.
All right. Bye, everyone.
Bye, everybody.